Hi guys, my name is Jessica Perez, and for my critical assessment, I chose to do the sport cross country at the high school level. And typically, the injuries that occur, the most common injuries that occur in the sport are Achilles tendonitis, plantar fasciitis, and medial tibial stress syndrome. And those usually occur because of all or one of these conditions. It's either incorrect posture while they're running, the environment, whether the athlete is either training on a rubber track, a dirt track, or on the streets, depending on the terrain of the streets. Lack of support in their athletic shoes that they wear, and overuse of the muscle or tendon or ligament that is being trained at that time. First, we're going to talk about Achilles tendonitis. Achilles tendonitis is an inflammatory condition that involves the Achilles tendon and/or its tendon sheath. Achilles tendonitis occurs when the tendon is either overused or the athlete is doing too much too soon and the tendon is not used to that kind of movement. As we can see here in the picture, here is an example of a ruptured Achilles tendonitis. You see how the back of the ankle is swollen versus the normal one, it's a lot thinner. Anatomy and assessment. Achilles tendonitis is a tough band of fibrosous tissue that connects the calf muscle to the heel bone. The Achilles tendon is also called the calcaneal tendon. The gastrocnemius and soleus muscles unite into the one band of tissue, which becomes the Achilles tendon at the low end of the calf. The Achilles tendon then inserts into the calcaneus and small sacs of fluid called bursae cushions the Achilles tendon at the heel. The Achilles tendon is the largest and strongest tendon in the body. When the calf muscle flexes, the Achilles tendon pulls on the heel. This movement allows us to stand on our toes when we're walking, running, or jumping. Despite its strength, the Achilles tendon is also vulnerable to injury due to its limited blood supply and high tensions placed on it. The patient may often complain of generalized pain and stiffness around the Achilles tendon region. Muscle testing may show a deficit when the patient performs toe raises. That's how you can assess that the athlete has Achilles tendonitis. There will also be pain at the back of the heel, redness and swelling as we saw in the previous picture. There will be restricted movement, as just previously stated, when the athlete tries to do toe raises. For rehabilitation and preventative measures, the athlete can do standing heel raises, which is basically calf raises, to help strengthen the gastrocnemius and soleus muscles. Also, modalities such as ice can help reduce pain and inflammation early on. And cross-friction massages may be used to break down adhesions that may have formed during the healing response and to further improve the gliding ability of the patron. Strengthening the gastrocnemius soleus muscles must be progressed carefully so as to not cause a recurrence of the symptoms. Also, we want to provide a proper healing environment. And with that being said, the athlete should not be running so they can put less stress on the muscle or the ligament, and instead because the athlete can still do cardiovascular exercises, for example, like the stationary bike, riding the stationary bike 3 times a week for 15 to 20 minutes. That way the athlete is still doing cardiovascular endurance and they are still working out their cardiovascular system, but they are restricting the amount of stress that is being placed on the Achilles tendon. Plantar fasciitis. Plantar fasciitis is caused by straining the ligament that supports your arch. Repeated strain can cause tiny tears in the ligament, which can lead to pain and swelling. Plantar fasciitis occurs when the ligament is overused. It is the most common cause of heel pain. Plantar fasciitis is a flat band of tissue ligament that connects your heel bone to your toes. It supports the arch of your foot. If you strain your plantar fasciitis, it gets weak, swollen, and inflamed. Also, the heel at the bottom of the foot hurts when you stand or try to walk on it. Plantar fasciitis is also known as jogger's heel. This condition is characterized by structural deterioration of fibrosis and pain of the plantar fasciitis on the foot. Plantar fasciitis results from progressive damage from repetitive strain and overuse of the plantar fasciitis. Factors increasing the strain on the plantar fasciitis, such as increased physical activity, excessive weight, age, or involvement in activities causing repetitive damage to the foot, have also been known to increase the risk for this condition. Also, athletes who have hyperpronation, known as flat feet, are more likely to develop this condition versus those athletes who are not flat-footed. Rehabilitative and preventative measures. It is important that the athlete stretch out the ligament prior to any activity. That way it can reduce pressure that is being placed on the arch of the foot. This pressure is a result from a sudden turn or landing that causes the arch of the foot to flatten or the toes to spread. It is important, for example, that the athlete place a small ball under the arch of the foot and roll it back and forth. This will stretch out the ligament. Prior to any activity, of course, they should do any kind of stretching so that the ligament gets warmed up and it's not just thrown into any kind of movement that can cause more strain or more stress on it. Also, after you're finished warming up and stretching and doing your ball rolls, the athlete should go to the athletic trainer and have the arch of the foot taped. That way they have proper support while they do their activity. Also, the athlete should have their running form assessed by a professional, either the coach, athletic trainer, or another professional, to make sure that the form is proper so that we can eliminate any overpronation problems and any imbalances that are happening during that movement that could also prevent this kind of injury. Medial tibial stress syndrome, which is also commonly known as shin splints, is when there is pain in the anterior part of the shin. Conditions such as stress fractures, muscle strains, and chronic anterior compartment syndromes have all been termed as shin splints. MTSS occurs when there is repetitive microtrauma. Factors that can contribute to MTSS include weakness in leg muscles, shoes that provide little support or cushioning, and training errors such as running on hard surfaces and overtraining. MTSS involves one of two syndromes: a tibial stress syndrome or an overuse syndrome that can progress to an irreversible extranational compartment syndrome. Anatomy and assessment. There are 4 grades of pain that can be attributed to medial tibial stress syndrome. Grade 1, pain occurring after activity. Grade 2, pain occurring before and after activity, but not affecting performance. Grade 3, pain occurring before, during, and after activity and affecting performance. And grade 4, pain so severe that the activity is impossible. The anatomy, the tibia bone, the tibialis anterior muscle or tibialis posterior muscle. The function of these muscles is to control the foot positioning during exercise. Their main roles are to dorsiflex or raise the foot and to control the arch during weight bearing. These muscles attach to the posterium a thin layer or connective tissue, collagen, that covers our bone surfaces. The posterium contains many more nerve endings and blood vessels compared with the adjacent bone, making it a particularly sensitive and painful structure when it becomes inflamed from overloading. Rehabilitation and preventative measures. Alternative calf raises, which is basically how we saw before, the standing heel raises, but instead of doing it at the same time, you can do them alternating, or also be in a staggered stance and do alternating or one at a time as well. It is also important to stretch the surrounding muscles. As we can see in the picture, the athlete is using a resistance band, so we can place it on a secure location and either dorsiflex the foot, so we can stretch out the tibialis anterior and tibialis posterior, or we can either dorsiflex or plantar flex to help stretch out those muscles. Ice packs can be used 1 to 3 times a day, preferably for 5 to 10 minutes. That will help reduce any inflammation and it will help reduce pain as well. As we can see in the picture, massage. The massage will help with any stress that is on the muscle, and it will also help with pain. And also we can tape the surrounding area for support to make sure that the athlete has proper support if they're going to be competing, if they wish to compete in their race or in their meet or anything that they're going to be doing. The proper thing to do is make sure that the athlete has proper support. Management of this condition is difficult because there are so many factors that can collectively contribute to the development of medial tibial stress syndrome. Activity modification along with measures to maintain cardiovascular fitness should be set in place immediately, as we stated previously. So instead of running, the athlete can ride a stationary bike, anything that's going to reduce the stress on the muscles, but still get them the cardiovascular endurance practice that they need. Correction of abnormal pronation during walking and running must be addressed with shoes and, if needed, custom foot orthodontics. Ice massage to the area may be helpful in reduction of localized pain and inflammation. Arch taping and circumferential tape applied around the area of pain may also be used, of course, to reduce inflammation and pain. The first thing is to address any calf muscle tightness with massage and stretching. That will help the athlete in its rehabilitation process. Also, by addressing any other muscle imbalances, including a core or lower limb strengthening program, to massage the lower limb or have a professional like the athletic trainer or your coach observe your running style may also help as a preventative measure. And finally, addressing any overpronation problems, either with appropriate footwear or pedidary assessment to help reduce considerable pressure on the shin muscles while you're performing exercises. It is important that the athlete has proper foot attire, making sure they have the correct support for the type of activity they're doing. They need to make sure they have the correct shoes and the correct equipment to help also prevent any kind of injury. Here is a link to my volunteer who is demonstrating all the rehabilitation preventative measures with stretching and exercises, and also having